Home Ministry's guideline for lockdown 2.0 to allow select activities to resume after assessment on the 20th. Health, agriculture, industrial units in rural areas and select utility services in the self-employed sectors may be allowed. Mass activities to remain prohibited. Face masks mandatory outside homes. Spitting made a punishable offence. Centre issues directives to states and the union territories to tackle COVID-19, seeks strict implementation of all the steps related to the lockdown 2.0 guidelines. The failure will mean no relaxation in the restrictions from the 20th of April. The Health Ministry says no community transmission of COVID-19 in the country so far. 170 hotspot and 207 non-hotspot districts identified. Door-to-door survey to be done in the hotspot areas. The number of active COVID-19 cases in the country now reaches 10,197 with 392 fatalities. Union Health Minister Dr. Vardhan holds a high-level video conference with the WHO officials. The minister says India has the lowest number of infected cases per million people in the world. The WHO's Polio surveillance team and other field staff joined COVID-19 fight in India. The External Affairs Ministry condemns the United States Commission on International Religious Freedom spreading misguided reports on COVID-19 protocols followed in India, says the Commission must stop adding religious color to national fight against the virus. No religion-based segregation in the Gujarat hospitals. WHO says it regrets US President's decision to stop contribution, even as Donald Trump accuses the organization of a tragic, horrible mistake in the early guidance. The global cases of COVID-19 now cross the 2 million mark. The death toll over 1,34,000. And the Indian Met Department predicts a normal monsoon this year. The June to September rainfall expected to be 100% of its long period average. That could prove to be a boon for India's farmers and the economy. Hello and good morning. You're watching Doordarshan News with me, Nancy Kohli. A top story as Prime Minister Modi had announced during his lockdown extension address to the nation on Tuesday. The Home Ministry came out with a revised set of guidelines the next day of which activities in which sectors that will be permitted from the 20th of April if the lockdown is strictly followed. And those lockdown 2.0 guidelines functional from April 20th in the health sector first. And talking about that, well, all the hospitals, nursing homes, clinics and telemedicine facilities as well, dispensaries, chemists, pharmacies, all the medicine shops, including the Jan Aushadhi Kendras and medical equipment shops. Also medical laboratories and collection centers that have been mentioned under the health sector category, and pharmaceutical and medical research laboratories, institutions carrying out COVID-19 related research as well. And those functional from 20th April in the agriculture sector includes the farming operations by farmers and farm workers in the field, the agencies procuring agriculture products including MSP operations. Also the APMC operated mandis or as notified by the state or the union territory governments. Direct marketing operations by state, union territory governments or by industry directly from the farmers, FPOs, cooperatives as well. Decentralized marketing and procurement at village level to also be promoted. The shops of agricultural machinery, spare parts and repairs as well. And those functional in the transport sector includes all the goods traffic allowed, transportation of goods by rail and parcel trains as well, the airports and the related facilities for cargo movement, relief and evacuation. Also seaports and inland container depots for cargo transport including authorized custom clearing and forwarding agents. Land ports for cross-land border transportation of the essential goods. The shops for truck repairs and dhabas on the highways. the movement of staff and contractual labor for permitted transport operations with passes from local authorities. And those functional in the private sector from the 20th, the print and electronic media including broadcast, DTH and cable services, IT and IT-enabled services with up to 50% strength, data and the call centers for the government activities only. The government approved common service centers at Gram Panchayat level as well. The e-commerce companies and vehicles used by e-commerce operators with necessary permissions, including also in fact the courier services and the services provided by self-employed persons like electrician, IT repairs, plumbers, motor mechanics and carpenters. And the enforceable national directives include the wearing of face cover that is compulsory in all the public and the workplaces. Social distancing also to be ensured by in charges of all the public and workplaces and even in transport. No gathering of 5 or more persons allowed anywhere. The district magistrate to also regulate gatherings like marriages and funerals. Spitting in public is punishable with fine. There is also a strict ban that continues on the sale of liquor, gutka and tobacco. And Centre has also issued guidelines to states on the lockdown that is to be strictly followed. The Centre has asked the state to ensure strict implementation of revised guidelines related to lockdown. The relaxation from the 20th of April is to be withdrawn if there is failure that will be seen anywhere. And let's now in fact tell you big takeaways from the Health Ministry's briefing, which talked about 170 hotspot districts that have been identified. And these districts are the hotspots where the number of infected patients is doubling in 4 or less days. 207 districts have been identified as the non-hotspot areas, and these districts are not the hotspots. The infection rate here is expectedly less in these districts. Also, in fact, a door-to-door survey in the COVID-19 active areas also taking place, and patients with cough, fever and respiratory problems are also being tracked. The officials are also ensuring that these patients are not suffering from coronavirus. In fact, also the efforts in the non-hotspot 207 districts is to see to it that they do not slip into the hotspot districts. The low-risk areas to also have cluster containment strategy, and there's been no community transmission so far that has been reported as yet, but the recovery of the patients from COVID-19 cases has also gone up. The rate of recovered patients is 11.4%. The Cabinet Secretary held a meeting with the officials of the state government and the districts through video conferencing as well. Now, talking of the All India figures, the total number of positive cases stands at 12,380. Out of these, 10,477 cases are active. 1,488 have been cured or discharged, and there have been 414 fatalities so far. Union Health Minister Dr. Vardhan held a high-level meeting with the World Health Organization officials through video conferencing on the measures to fight the COVID-19 infection. Later, the minister also held a press conference and said the situation in the country is under control and India is in a better position than the rest of the world.
Our incidence is per million the lowest in the whole world. It ranges between 4 to 8. At different times it has ranged like that, although for many of these countries it is in few thousands, 2,000, 3,000, 1,000 like that. Right now we are quite well placed in the sense that we know our enemy. We also know where our enemy is, and the talk about these hotspots is, I think I must congratulate our surveillance people, our IDSP people, our WHO people, all those who are involved in this, and particularly all our state governments, that we have been able to pinpoint where the virus is right now.
And tapping onto the best practices and the key resources that help India win its war against polio, the Ministry of Health and Family Welfare and the World Health Organization have initiated a systematic engagement of WHO's National Polio Surveillance Network and other field staff for COVID-19 response. While addressing a high-level meeting with the WHO officials, the health minister said that with the combined meticulous work of the Government of India and the World Health Organization, India got rid of polio. Dr. Vardhan called on the people on the front line as corona warriors. The regional director of the WHO Southeast Asia said that the National Polio Surveillance Project played a critical role in strengthening surveillance for polio cases that generated useful, timely and accurate data to guide the policies. She also stressed upon the vital role of surveillance in making future strategies for containment of COVID-19. The NPSP team will also support in sharing information and the best practices and help states and districts calibrate the response based on transmission scenarios and the local capacities. The Union Finance Minister Nirmala Sitharaman participated in the virtual session of the second G20 Finance Ministers and Central Bank Governors meeting under the Saudi Arabian presidency on Wednesday to discuss the global economic outlook amid evolving COVID-19 pandemic crisis. India has disbursed financial assistance amounting to $3.9 billion to more than 320 million people. The policy measures undertaken by the Government of India, the Reserve Bank of India and other regulators have helped defreeze the market and catalyze the credit flows. The G20 preparing an action plan to safeguard people's jobs and incomes, restore confidence, preserve financial stability, revive growth, provide help to countries needing assistance, coordinate on the public health and financial measures, and minimize disruption to the global supply chain. It is also being hoped for the global community to overcome this crisis soon, and the minister said that the lessons learned will enable us to develop prudent policy measures to combat any such crisis in the future. And the finance officials from the group of 20 major economies agreed to suspend the debt service payments for the world's poorest countries through the end of the year, a move quickly matched by a group of hundreds of private creditors. The decision was taken at a virtual conference. The actions to freeze both principal repayments and interest payments will free up to more than $20 billion for the countries to spend on improving their health systems and fighting the COVID-19 pandemic. The World Bank Group President David Malpass and the IMF Managing Director Kristalina Georgieva have welcomed the decision of the G20 group of leading economies to suspend the repayment of official bilateral credit of the poor countries. In a joint statement, they said that this is a powerful, fast-acting initiative that will do much to safeguard the lives and the livelihoods of millions of the most vulnerable people. They further added that the World Bank Group and the IMF will move quickly to respond to the G20's request to support this action by working closely with these countries in ways that make the best use of this vital lifeline. In response to the media query on a tweet by the United States Commission on International Religious Freedom on India, the official spokesperson Anurag Shrivastava said that the Commission must stop adding religious color to India's national goal of fighting COVID-19 pandemic. He further dismissed the Commission's claim that COVID-19 patients in Ahmedabad hospital segregated based on religious identity. He also ensured that there is no segregation of COVID-19 patients at a civil hospital in Ahmedabad on religious lines. He's accused the Commission spreading misguided reports on professional medical protocols followed to deal with COVID-19 in India. And the World Health Organization chief has said that he regretted the US President Donald Trump's decision to pull funding for the agency and also called for the world unity to fight the COVID-19 pandemic. Addressing a news conference, the WHO chief said that the World Health Organization is reviewing the impact on its work of any withdrawal of the US funding and would work with the partners to fill any gaps to ensure its work continues uninterrupted.
The United States of America has been a long-standing and generous friend to WHO, and we hope it will continue to be so. We regret the decision of the President of the United States to order a hold in funding to the World Health Organization. With support from the people and government of the United States, WHO works to improve the health of many of the world's poorest and most vulnerable people. We're committed to serving the world's people and to accountability for the resources with which we're entrusted. In due course, WHO's performance in tackling this pandemic will be reviewed by WHO's member states and the independent bodies that are in place to ensure transparency and accountability.
The American Medical Association has called on the US President Donald Trump to reconsider his decision to temporarily halt funding to the World Health Organization over its handling of the COVID-19 pandemic. Trump said that the WHO had failed in its basic duty and it must be held accountable. He said it promoted China's disinformation about the virus that likely led to a wider outbreak. In a statement, Dr. Patrice Harris called it a dangerous step in the wrong direction that will not make defeating COVID-19 easier and urged Donald Trump to reconsider. And the US President Donald Trump will make an announcement on the guidelines for reopening parts of the country amid the COVID-19 pandemic. In a White House briefing on Wednesday, Trump said that the data suggests the US has passed its peak of new cases and such encouraging developments allow for finalizing guidelines for states on reopening. He further said that more than 20 states were in extremely good shape and some could reopen even before the end of April when the current federal social distancing guidelines are set to expire. And the US's correspondent Jagruti Dave has more details.
Said the coronavirus peak had passed in the United States and that he'd be talking to state governors to discuss the gradual reopening of their economies. He said that some states could reopen sooner than others depending on the level of infections in their states. And he said that some could even reopen before the May the 1st deadline. Earlier, the president had had a call with business leaders from various sectors ranging from retail to banking, financial services, hospitality, as well as other industries. Industry leaders had the opportunity to put forward their views on how the steps needed to be taken to reopen the US economy. And according to reports, industry leaders said to the president that virus testing needed to be ramped up before employees could safely return to work. At the briefing, the president also talked about his decision to freeze funding to the World Health Organization that he'd announced yesterday. He also repeated the attacks on the World Health Organization for what he described its mismanagement of the coronavirus outbreak. The president also threatened to adjourn Congress in order to fill vacancies in his administration, which he said it was very difficult to govern without them.
Now, the New York City Mayor has announced a $170 million initiative to feed New Yorkers in need amid the novel coronavirus crisis. The initiative, funded through the city's budget, includes hiring taxi and the app-based drivers to deliver food to people in the greatest need, purchasing 18 million shelf-stable meals to keep in reserve, helping protect existing food supply by getting supermarket and grocery store workers appropriate personal protective equipment or the PPE, and $25 million to support food pantries and soup kitchens. In the largest single-day increase, Bangladesh has reported 219 fresh cases of coronavirus and 4 more deaths, including a physician, in 24 hours since Tuesday afternoon. With this, the total number of deaths due to COVID-19 in Bangladesh has gone up to 50 and infected cases to 1,231. Announcing this on Wednesday in Dhaka, the health minister said that 49 people have recovered so far. He said that most of the new cases were reported from Dhaka and Narayanganj. Ghazipur, Karniaganj and Maiman Singh have also reported a sharp increase in the corona patients. Meanwhile, Bangladesh Prime Minister Sheikh Hasina has mourned the demise of the physician and declared that the government will take care of the entire family of Dr. Moinuddin. Maldivian President Ibrahim Mohamed Solih has made an emotional appeal for people to stay indoors following confirmation of the first COVID-19 case in the capital Malé. In an address, President Solih urged the public to treat each other with care and remain patient and assist each other according to the letter and spirit of the Islamic teachings. His appeal followed a person with no travel history testing positive in the congested Malé. The health authorities immediately announced a 24-hour lockdown in the capital, which may be extended. The Maldivian president emphasized that work is underway to determine the source of the infection. He said 11 samples of direct contacts are being tested currently and contact tracing is underway in the Kashidu island, where a direct contact of the patient had recently traveled. Earlier, the 20 cases tested positive in the island nation were either among the foreign tourists or people who had traveled abroad. Now, Colombia will temporarily release around 4,000 prisoners to house arrest in an attempt to stem the spread of coronavirus. The measure is directed at the prisoners who are expecting, disabled or over the age of 60, women prisoners with children under the age of 3, and those with cancer, diabetes or cardiac problems, the conditions that often lead to bad outcomes if they contact the virus. The house arrest measure will last 6 months. 2 people recently released from a prison in the central city of Villavicencio died after contracting the coronavirus. 13 other prisoners, 2 guards and an administrator in the same institution have also confirmed COVID-19 infections. And living in close quarters under crowded conditions makes prison populations especially vulnerable to the spread of the COVID-19. And in more news now, in fact, from back home, a newborn at AIMS is corona positive and keeping the humanity. In fact, 2 nurses of the hospital are now taking care of the baby in their dock like a mother, in fact, feeding her as well. Let's take a look. Those 2 nurses, they're in fact leading by example, in fact also motivating us in these difficult times to play different roles thereof, a caregiver and a nurturer. On that note, it's a wrap on this edition of the news. Thanks for being with us.